dental surgeons, dental colleagues, interns, students all over the world and in India. A very good morning to you all. Today is 18th April and the year is 2020. India has been in lockdown for 25th day today. The year 2020 will be remembered for ages for COVID-19 and this massive lockdown. So today I bring for you the first ever YouTube dental talk show by the name of denTok. So this show is basically a show of the dentists, by the dentists and for the dentist, which means that it's for you, me and everybody else. And I am Dr. Amanish Singh, a dentist and an orthodontist who will be your host for denTok. I want denTok not to be a very serious kind of a show. In fact, I want it to be a casual show where the information is given in such a way so that you don't feel burdened by the academic curriculum kind of thing. It will have something of everything, seriousness to casual approach and entertainment and something for the students also. Along with that, we will discuss the burning issues, the good news and the bad news and suggestions, etc. etc. When the world is in a lockdown, it's hard to find good news, but still we have some good news, and the good news today is that in India, the duplication rate, that is the number of days by which the COVID cases was doubling up, has increased from 3 to 6. That indeed is a very good news. We are all aware that COVID-19 has hit the entire world. But do you know whom has it hit the worst? The dental surgeon is one person who has been hit the hardest. And that is the probable reason that in these hard times, the dental surgeons are coming up with so much of information for the fellow dental surgeons, what to do and what not to do, how to think about their practices, etc. In these tough times, it is worth a compliment to certain people. You know, there have been seminars and webinars and messages all across the globe, out of which many of wonderful webinars are originating from India. Worth a special mention are Dr. Santosh Ravindran from Mumbai, who came up with an audio message a couple of days back. In fact, very soon after the COVID-19 lockdown was imposed, he was the one who said that no, right now is not the right time to go back to the clinics. Then came the famous webinar of Dr. Gopi Krishnan from Chennai, who came up with a webinar on the topic Life After COVID-19. I was very glad to see news a couple of days back. You will be surprised to know that Himachal Pradesh government has actually created a dental helpline wherein Dr. Ashu Gupta, the Director Principal of the Government Dental College Simla, will be available on phone from 11 to 4 p.m. every day of any kind of queries regarding to dental pain or otherwise. So all in all, we understand that the entire fraternity is doing something for each other, and it's a wonderful, wonderful news. Coming to the burning issue of today, I mean, in this day today, what else could be a burning issue except for COVID-19? What happens is that every morning when we pick up the newspaper, we get some reports, and you get similar reports from televisions also. But the very next morning you see that those reports have a contradicting report the next day. The situation is so fluid, the information is so limited, there are no concrete information as such, but still the world is struggling. Amidst all this COVID-19 furor, there is a funny news, and that news is that Corona beer, which was being manufactured in Mexico, has stopped their production, probably because of the name. In today's episode of denTok, we are going to discuss a little bit of COVID-19, but not from the perspective of a virologist or a microbiologist, rather like a layman for a dental surgeon, what needs to be known. And there are hordes of questions from the dental surgeons, and we are going to discuss them all. Today, we will also be having expert panelists with us. The panelists for today's denTok episode are Dr. Mahesh Verma, the erstwhile principal of Maulana Azad Dental College, and who is now working as Vice Chancellor in the Indraprastha University. Our second panelist for today is Dr. O.P. Kharbanda, Director and Chief of Research Dental Wing, All India Institute of Medical Sciences, also Professor and Head of Orthodontics. From all the information available from all these days, we are all aware of most of the things about coronavirus. But I'll just take a quick recap, and the first thing which I would like to know is, why is it known as coronavirus? The word corona comes from crown. From the body of the coronavirus originate certain spikes, and when you look at those spikes from the side, it looks like a crown. So the name coronavirus. The next question which comes to your mind is, after all, why do they call it as novel coronavirus? Now, any organism which has not been found in human beings earlier is always named novel. So it's novel coronavirus. COVID-19 belongs to the series of coronavirus which already has SARS and MERS, and it has almost the same genetic material. But you will believe that 6,000 mutations has taken place to give rise to COVID-19. This mutated species of COVID-19, no vaccine previously found works on them. COVID-19 is highly contagious, which makes it 10 times more deadlier than its previous series, and it spreads like a wildfire. In the period of lockdown, we are all watching Netflix series, we are all watching films. I have a suggestion for you. Please go find out a film by the name Contagion. It was released in 2013. And when you watch this film, you'll realize as if the world today is living in the same period. The film has the setting in China, where the similar kind of disease appears. The poster of the film says, "Don't talk to anyone, don't touch anyone." Now, isn't it as similar as the condition today? Don't talk to anyone, don't touch anyone, and maintain a social distance. A complete lockdown. So in 2020, our contagion is COVID-19. And let's find out what makes it actually so deadly. Professor Newman from A&M University, Texas, he's a biologist. He says that why it is so deadly, the secret of that lies in its structure. According to Professor Newman, the virus lodges itself in the oropharyngeal space. The infection begins when the long spikes of the virus embeds and latches into the host in the ACE2 protein of the cell. Hereon, the spikes fold and unfold itself, and the virus crashes into the cell. This forms a channel, and the genetic material from the virus actually snakes into the absolutely unsuspecting cell. There is a lot of controversy and confusion regarding the spread of the virus. We are all aware that it has an oral spread in form of a droplet infection, and people say that if the virus goes into the gut, it just gets killed away. While it causes the respiratory symptoms when it goes through the oral route, but when it goes into the gut, it causes diarrhea, it causes loss of taste, it causes loss of sense of smell. However, when it affects the lungs, the worst thing which happens is this severe acute respiratory syndrome, causing the lungs to be damaged and patient expires. As we've just talked about the host having the ACE2 proteins, you'll be surprised to know that the saliva has the maximum concentration of ACE2 receptors because it is highly concentrated in the salivary glands. So that creates the maximum risk to the dental surgeon because that's the area where we work in. Before we go into further questions, let's ask our panelists a few questions. A very warm welcome, Dr. Mahesh Verma, to denTok and its first episode, sir. So the first question for you is, when will the dentist be able to get back to his clinic? And also, will the life for a dentist be same post-COVID-19?
The wishful thinking is that they should be going back to their practices as soon as possible, but is it feasible? At the moment, we have to observe the directives of the authorities, and as we all know that the lockdown has already been extended up to 3rd of May. But I think the most important part is not the timing. I think the important part is that we should be able to understand that whenever we go back to practice, what are the protocols we need to be putting into place. As soon as we are clear about that and we are able to implement that, I think that would be the appropriate time to go back to the practices. The other day I was talking to Indian Medical Association and they said we should go back to our practices as soon as possible. They said the medical department should be the first to show to showcase that they can resume their work as soon as possible. But since dentistry is procedure related and we need to implement law. Would the dentistry be same again? Yes, we would like it to be same, our proud profession. But as we all know, in a new scenario, we need to strengthen sterilization protocols, disinfection protocols, and it may, everything. There is a cost to everything, and we would want our end user not to be affected by the efficiency, efficacy, and quality of the treatment. And we also do not want our end user, our patient, to be burdened with the additional charges. So this is a catch-22 situation. But yes, I feel that this may be a short-term loss, but in long term, it has given us a new learning. It has awakened us. We are more conscious about universal precautions, best practices. Our sterilization protocols have been strengthened. Our understanding of these, understanding and relevance of these protocols has increased. So I think in long term, it is going to make our profession more fruitful and more strengthened.
This was Dr. Mahesh Verma with his very valuable words for all of us. Ladies and gentlemen, with great difficulty, we have got Dr. O.P. Kharbanda online. Let's see what he has to say about COVID-19 to all of us.
I think you have raised a very pertinent point at a crucial time when we are trying to live during and post Corona period. We all know that the world is going through a pandemic and it has its own course. And with regard to Corona COVID-19, which is a novel virus, the duration of pandemic is not certainly known. Therefore, any patient who is walking in the clinic is suspected to be carrier of this virus. So when somebody is visiting your clinic, the danger is bidirectional.
Thank you, Kharbanda sir, for your short and sweet message and a very informative one. And we do understand that in the time to come, every patient coming to our clinics is considered to be someone who is probably a carrier of COVID-19. Thank you so much for being with us, sir. Thank you. So, ladies and gentlemen, this was Dr. O.P. Kharbanda, Chief, Center for Dental Education and Research, All India Institute of Medical Sciences, and also the Professor and HOD of Orthodontic Department. Now, out of all this, we need to know, after all, what is right for the dentist to do. So, are there any guidelines or any publications right now regarding how to manage a COVID-19 patient or how to manage other patients? Since the time span from the onset of the disease till today is very less, there are many publications which are in press, but there is nothing concrete. But we logged on into the website of National Center for Disease Prevention. The site was updated on 5th of April 2020, but to my utter surprise, the high risk job people did not include the dental surgeons in it. However, they had mentioned that any setups which create an aerosol are hazardous and can communicate the disease. The procedures like endotracheal intubation, tracheostomy, even a CPR where the ventilation appeared and happened were included in the high risk category, but there was no mention of a dental surgeon. In a pursuit to find more, we logged into the site of Center for Disease Control and Prevention, United States of America, the office of which lies in Georgia, Atlanta. And what we found there was that there was a dedicated page for the dental surgeons with extreme updations of what to do and what not to do. The very high risk exposure candidates or the professionals, healthcare professionals, dentists rated at the top, along with doctors, nurses, laboratory personals, and more workers. Dental colleagues, I really recommend the site of CDC, which gives you a complete updation and complete guidelines how to treat a COVID patient, how not to treat a COVID patient, how to have your manage your practice at this hour, etc., etc. Also, you must like their Facebook page, after which you'll get the updates on a regular basis on your Facebook. The most important declaration on the CDC page for the dental surgeons was that in order to protect staff and preserve personal protective equipment and particular supplies, the Center for Disease Control and Prevention recommends that dental facilities postpone the elective procedures, surgeries, and non-urgent dental visits and prioritize urgent and emergency visits and procedures now and for the coming several weeks. Mind you, it is the same declaration as American Dental Association has come up with. Fortunately, even Indian Dental Association has come up with this declaration now that we must all postpone all the procedures as of today. You must observe that the first line itself says to protect your staff and to preserve your personal protective equipment. Everybody is aware about this fact that after the COVID-19 episode, the PPEs have just disappeared from the market. Either they are being sold at a very high premium and whatnot. So this is the reason that you have to postpone the procedures so that you can preserve the PPEs, particularly for the cases of probably COVID-19 who come to your practice tomorrow for an emergency dental procedure. Dental healthcare professional includes, other than dental surgeons, the dental assistants and the dental auxiliaries and chairside assistants also. They are as human as we are. Just yesterday, a study came up where it says that the dental auxiliaries, dental hygienists, and others are at a 98.2% risk, which is more than the risk of a dental surgeon who probably will be wearing his complete set of PPEs, and that's just 92.4%. As dental surgeons, we are all aware that our pneumatic handpieces, ultrasonic scalers, they do create an aerosol. And believe it or not, the aerosols can travel 100 centimeters horizontally and approximately 50 centimeters vertically. It stays and reaches out to the farthest corner of your room. What could have been worse that the virus can survive in these aerosols and on the contaminated surfaces not just for a few hours but for 72 hours, which makes it 3 days, which means you did a procedure one day and when you're coming back the third day, the virus is still waiting for you. So does it mean that when we go back to our clinics after this COVID-19 thing, will we have to buy those high-powered suctions which is known as high-vac or something? And do you know what's the cost of a high-vac? It's approximately 80,000 rupees to 1 lakh rupees. In such a circumstances, are we going to be dependent on China, Taiwan and other countries for such machines? Can India not manufacture or invent such machines on its own? I urge the dental surgeons and especially the dental students and the interns of this nation to think of innovative things today. Now is the time. Believe it or not, India features 57th position in the Global Innovation Index. That's very, very small. And do you know which is the country which is at number 1? It's Switzerland. The number of engineers in India is equal to the population of this country, that's Switzerland. And it has maintained its first position for years now. The dental surgeons, young or old, undergraduates or postgraduates, a student first year to final year, anybody can think of an innovation at this hour. All you have to think is the silliest of idea which today seems unreasonable, but tomorrow it might be a reality. Here is a challenge from denTok. All the dental surgeons, all the dental students, all the interns of the nation, if you have any idea which can bring about an invention tomorrow regarding dentistry, kindly put that idea on a piece of paper, make an artificial design and make a small video for up to 15 to 20 seconds or even little more and send it to us. We will feature that in our next episode and we can probably help you working on it. I also urge the principals of various dental colleges in the country to have an innovation wing in your dental colleges, because now is the time that the students can be inspired to create something bigger and greater. High back machine is what? A high powered machine, a high powered motor which is sucking through the air. Is it not possible for the Indians to make such a small thing? Can't we just bring a few pieces of instrumentation and engineering skills together to make such a machine? ISDR, that is Indian Society of Dental Research, of which even I am a member. I request Dr. S.M. Balaji to kindly open up and invite some applications from across the country where the students can actually participate in such contests or the challenge contests where they can create certain things and where we can help them actually manufacture them at the end. For all those Indians who think that we cannot do it, let me tell you, Oyo Room's Ritesh Agarwal was 18 years old. Flipkart, Binny and Sanjay Bansal were 19 to 20 years of old. Paytm, Vijay Shankar Sharma was 40 years old. All these companies who are leading the world today originated from India. So your one good idea can make you a star tomorrow. Rather than having routine conferences, we can have a segment of innovators or innovation think tanks. The conferences must have a section where only innovators from the dental field are entertained. Their ideas are listened to, and we can invite people from the industry who can think of manufacturing it. I think that's the way to go ahead from today on, and that will also justify what our worthy Prime Minister says, make in India. My message to all the dental students of this nation, take an initiative. Ask for a research and innovation wing in your college. Ask for a structured research and innovation time out of your curriculum. Think impossible, unimaginable, and think unusual, but think big in these workshops. Put your idea on a piece of paper and design it. Present it and turn the unrealistic dreams into a reality. I would like to cite an example of one of my old students who would collect the wax from the pre-prosthetic labs and turn candles out of it. It was innovation, even small, but after all, making something out of nothing, that's what innovation is all about. Ladies and gentlemen, before we wind up today's session, the one and the most important thing which I would like to share with you is that if you have to fight an enemy who is stronger than you, you need to have the weapons right for him. So what is that you need today? Remember the masks which you routinely use, that is the surgical masks, and a 3-ply mask is not the right mask for an oral health care professional. These masks are for the community settings. Say you go to a market, say you go to a grocery store, good enough. If you are going to the dental college, dental hospital tomorrow, you require the latest weapon, and that is your N95 mask. N95 mask is approved from Occupational Safety and Health as an organization, that's OSHA. The pore size of an N95 mask is 0.3 microns. It's even bigger than a normal virus, that is 0.12 microns, but still it protects. It has been proved that N95 mask with its complete seal all around the face is actually 95% secure and safe. The another very important thing for a dental surgeon is a face shield. I do not know whether it has reached you or not, but we have developed a face shield which can cover this face from all sides. You can make it on your own, you can make it in 10 minutes, you can make it in less than 10 rupees from an ordinary OHP sheet. We will share the YouTube link for this particular invention to all of you. You can have a look and you can make it on your own. And just before we wind up, another question for Dr. Mahesh Verma. The question is, sir, that here on, will the dental surgeon have to treat all his patients as COVID-19 patients? And what changes do you think he will have to make to his practices here on?
When it comes to treating every patient by the dentist as a carrier of COVID-19 virus, yes. The rule of the thumb is that every patient coming to dental office could be a silent carrier of virus, and who could be a potential case and who could be harboring infection. We all know that there is a window period. During that time, patient doesn't exhibit any symptoms, and also, as per one report, almost 1.2% of patients who are active patients do not exhibit any physical symptoms. They remain asymptomatic. So the moral of the story is that every patient coming to dental office is to be treated as if a potential case of COVID virus infection. Regarding which all areas in the clinic requires change, I feel that entire clinic requires a relook in terms of its planning, execution of activities. Right from the beginning, as a patient schedules appointment on phone, I think we can start alert from then on. When a patient is asked, taken history on phone itself, and then as soon as the patient enters the clinic, from there on till the patient exits, I think every area requires revamp, requires relook, require changes. Objective is that we do not want to inflict any damage to patient, to our staff, and of course we have to protect ourselves. So we got to implementing a tougher, stricter practices, sterilization protocols, and of course, to begin with, there will be fewer patients, and whether it is X-ray, whether it is lab, small lab in the office, every area, operatory, I think we all need to, we need to relook it, we need to redesign it.
Thank you, Dr. Mahesh Verma, for your suggestions and for your time, sir. It was indeed a pleasure to have you in the first inaugural episode of denTok. Dental brotherhood, dental fraternity, dentisans, ladies and gentlemen all across the world, we approach towards the end of the first and the inaugural episode of denTok. Now, if you have any questions, if you have any suggestions for us, please record your videos for not more than 15 to 20 seconds. Send it to us across, and we will try to feature it in the next episode with your questions along with. In the meanwhile, while you are in a lockdown, you are dentists who are artists also. If you are drawing, painting, writing a poetry or writing a story, please send it to us and we will let the world know what you are doing at home. We have tried our level best to bring whatever best we knew we could do for you. If you liked it, please like it and share it. Let it reach to all the dental surgeons across the country and across the world, so that we can have more content, more idea, more suggestions coming to us for the next episodes of denTok. I'm waiting for some denTok videos from you. Please send those denTok videos just as a TikTok video, and we will be highly thankful. Please do not forget to subscribe, because if you subscribe, only then the next episode will reach you without you making any effort. So please do not forget to subscribe this channel. Till then, ladies and gentlemen, I, Dr. Amanish Singh, sign off from the denTok studio. In this COVIDified world, keep home, keep safe, and God bless you all.